is Amanda Hildenbrand, and today I'm going to tell you about a crown prep tray setup, and that's all. We're going to get it started. For a crown prep tray setup, first you're going to check the patient's history and make sure everything's signed and everything has gone through with the patient. If they have any questions, they're all answered. Then you're going to go ahead and tell the patient to take a seat. Once you're ready, call them to the back. Once you call them to the back, go ahead and put their bib around them, and you should already have your tray set up with your HVE, air and water, and your saliva injector. Then you should also have your cotton and your cotton rolls. Gauze, my bad. Then you also have your topical and your Q-tip for the topical. Then you have your syringe, your needle, and your local anesthetic, whichever one is for the patient. Then you should have your shade finder. Once you have that so far, we'll get to this after. Once you have this is already a must be on the instruments already. This stays on the tray. This you could go ahead and place on the patient's teeth or tooth, whichever one you are working on. Then you're gonna go ahead and get the syringe and install the needle on top. Make sure you screw it on and don't remove the cap until it's used. Then you're gonna go ahead and place your corporal into the syringe and go ahead and hit it once so it's already in there and it's not, the doctor doesn't have to hit it. Then you're gonna go ahead and start and find your shade of the tooth that you will need for the crown. Once you find the shade of the tooth, you could go ahead and write that down. And then we're gonna go to your high-speed handpiece. This should already be plugged in with the rest of the instruments up here. Then you have your burrs. You have your 557, you have your round burr, and then you have your diamond burr. These are just the most basic used burrs in the office. But if whatever doctor you're working for, they'll tell you which one is their favorite and they'll let you know so you can have those burrs ready. But these are just the most common ones set up for this. And then once the doctor starts working on the tooth and drills into the tooth, they'll get a spoon excavator to remove all decay out. Get your surgical scissors and cut as much as your retraction cord as you need. You'll get your Humidant, pour it into a Depend dish, put your cord in it and let it soak. Once it's done soaking, you can remove it with your cotton pliers. And then you'll put it around the tooth with your cord packer and pack it into the tooth. You might want to check with your doctor in case your patient has a heart problem and can't use the retraction cord. Then it's time to take an impression. You'll have two options to take an impression. You have your wax bite and then you have the insert kind. It's up to your doctor what kind of impression they want. They can either do the whole arch, half an arch, or even the little area with just a tooth, which is, I believe, a quarter. It's just up to what doctor you have. Then you'll remove the cord. You'll dry the tooth and take your final impression. You'll use a triple tray, determining what size you'll try them on, whichever one works for you. And the impression will take the tooth that you're working on, the opposite arch, and a bite registration automatically. So you might not need to take a wax impression or a poly impression. After the triple tray, you'll get your triple tray and you'll put your light body on the tooth that you're working on to get as much as a detailed impression as you can. Then you'll put heavy body around it to fill it up. Then the time to sit on the patient's tooth, you would have to read the instructions on whatever time they tell you to take it off. And all your heavy body and light body is added and the impression is done. And then you will make your crown. You either make a crown or get a prefabricated crown. You must trim well, address the contact, and it must be a strong crown to last at least 2 weeks to a month. Your final step to check the crown is to check the occlusion with articulating paper to make sure that the patient is able to leave the office and their tooth will not bother them or could cause it to break. Then the purpose of a crown is to maintain tooth function, provide comfort to patient within waiting and protect margins of the tooth. You'll write a lab slip as a prescription for the crown type. It could be a porcelain, a metal, a certain metal, a single, or a bridge. It just determines on what the doctor thinks is best for the patient or what works best with their tooth. Now we could proceed into home care or post-op. You are allowed to clean your temporary crown. You need to brush and floss softly daily. You must be careful, but make sure it is done right. You must eat normally, or you could eat normal, but just be cautious of what you eat. No gum chewing, no hard foods or candy, because the temp could pop out at any time. If the temp does pop out, you could always call your doctors, your dental office, and make an appointment to get it re-cemented in until your final crown comes in. You can also use a floss threader along the gum lines. After that, the final operation is to cement the final crown into the mouth. After this is done, after you review with your patient about home care and post-op, you could go ahead and send them home and tell them that if anything is wrong, go ahead and call the office and then give them a copy of the post-op and home care.